Welcome to week 7, module 7. I am going to share my screen, so bear with me. Okay, so we will provide a quick overview of Claywell chapter 16. Here are the learning outcomes that you should be familiar with. All right, so chapter 16 discusses managing care in secondary and tertiary health care. And I am going to provide a brief summary of some of the important things in this chapter that you should be familiar with. So as the RN, you are the manager of care. You must deal with some of the unique problems that arise in the acute setting. These problems can be environmental, spiritual, cultural needs and influences, any type of social needs, developmental needs, and then also you have to be a resource manager. So the environmental influences, prior experience can be positive or negative for the client. So you need to orient the client to the physical environment of the acute care setting. You need to implement continuous assessment of your client's response to the environment. There are spiritual needs and influences as well. Clients may experience spiritual distress. They might need to be referred to a chaplain or whatever religious preferences or spiritual preferences they have. So you need to respect their personal wishes and beliefs. They may require a prayer or a spiritual guide. And you need to also create a culturally sensitive healing experience for your client and their family as well. Communication time orientation, spatial orientation, social organization, environmental control, biologic variation considerations, and cultural strain can hinder the healing process. Developmental needs and influences for acute or chronic illness may threaten developmental tasks. Role strain is possible for the caregiver as well. Social needs and influences, the patient's social support may be interrupted, so you need, as the RN, to support the family, provide open, honest information about the hospitalized family member to whoever the loved ones are. Anticipate providing updates and other information without the family is having to solicit the information. Allow access to the client whenever possible. The client's standardized care plan defines nursing care, outcome criteria. There is a clinical pathway that you need to be familiar with and that you're going to be going over with this week. And some of the hospitals use these clinical pathways, and there are some benefits and there are some barriers to utilizing these clinical pathways. So always remember that client needs always take priority, and there might be times where you have to limit the visits to the client so that way care can be given, but family can be involved in this care as well. So as RNs, you're going to evaluate the effectiveness of the plan of care and the patient's progress towards discharge. And then you use a collaborative approach to adjust the plan of care. You're also the resource manager, where you do tertiary referrals, such as to a caseworker who will make recommendations and making arrangements for transfer to a different facility if that's necessary. Or you may refer the client to hospice if they have 6 months or less to live. The priority of care is the patient's peaceful and dignified death after living life for hospice. You may refer the family to respite care, and that's intended to offer the client's family members time off from their dependent care duties. You may refer them to home health care, which provides assistance to the client family for a short period of time after discharge to their home. Don't forget, you have a question in Claywell. Here's your question, and here are the learning outcomes for chapter 16. All right, thank you. That is it for this chapter.